Welcome. I think we're ready to get started. Lucia, you want to kick us off?
Yeah. Welcome, everyone. Thanks so much for joining us. We are here to talk about the Ventura County Child, Youth, and Family Wellness System dashboard. Ventura County calls their systems of care work and prevention work wellness system work. And so we're going to go ahead and start with a poll for all of you today to see where you're at in your dashboard development. And I did create the poll through the Hoover app. Do I need to press something for it to make it go up?
Think when we logged in, everybody was
Oh yeah,
asked
everyone
the
did it. Okay. Are we able to see the results?
it's a good question.
I can snip it. Oh, there we go.
All right, let me.
Okay, yeah, when you submit, you should be able to see if I can share it.
So for this one, it looks like we have
Oh yeah.
12% of participants have developed one in their county, 43%, so 14 folks would like to but haven't yet. And then 8 people, this isn't quite on their radar yet. And then 6, I think, were in the wrong breakout session. So
Well, I hope you stay if you want to learn about this or find what breakout session you're supposed to be in. That's really great to hear that some of you have developed yours too. I hope you jump in and join the conversation if it's on your radar and you don't know where to start or have had some starts and stops. We can relate to that and we will share our experience with you. Okay, so one question we also had you answer was, what are you hoping to get out of today's session?
So these are some of the responses. Sorry, it's a little hard to see. So some more knowledge, clarity, new information to help the respective counties grow, ways to help former and current foster youth, connection, knowledge, wisdom, truth, new ideas on how to continue to support and move prevention strategies locally. We already have one to learn about this dashboard, helpful information, dashboard concepts, and then tips on how to create a dashboard.
All right, we will try to keep those in mind. Thanks for sharing those comments. Okay, so this is one of our graphics that we've designed in Ventura County, and there's a lot of information on here. So I'm just going to speak to it and really talk about where this all began. So, of course, many of us know that in 2018, the federal government passed the Families First Prevention Services Act, which allowed us to draw down funds for prevention dollars. And in 2018, in California, we instituted and passed the Assembly Bill 2083 requiring interagency leadership collaboration. Despite whether counties had governance structures that were under the same umbrella or not, they needed to work together on behalf of the family and the communities that they were serving. And 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 this included having a shared metrics and sharing data and making sure they're having discussions about data. And as we learned through our process, and I'm sure many of you have learned this through your process as well, every system partner, agency, we all have a lot of data. So it's narrowing that down and prioritizing and figuring out what data is going to be prioritized, what's going to be looked at in across interagency leadership teams, and what's that process really going to look like. And I think we would say even in Ventura that it's still going to evolve, even though we've developed a dashboard, it's going to continue to change. And we're going to continue to refine the measures and create or have new ideas about what else we should be looking at. And then in 2021, of course, the state instituted their own Families First prevention services to be able to draw down the federal dollars for prevention in California. And then in 2021, we developed our interconnected interagency, intercommunity teams working together. They've got built-in feedback loops. I'm going to share a little bit more information about that in the next slide, but really developed a shared vision across the county and shared governance across the county, which really even made this dashboard development possible. Otherwise, it wouldn't have been possible. So in 2022, continuing on the path, we had a lot of ICPM trainings, and you may or there's a lot of behaviors in ICPM, so not everybody may remember or recall this, but system level data sharing is also part of our ICPM inter interagency core practice model. So this is very much in line with everything that we're doing with Families First, AB 2083, ICPM, and then in 2023, like many of you also probably developed your comprehensive prevention plan, and it detailed the strategies that we were going to implement. And we're going to talk a little bit about how this dashboard is going to be connected to that eventually. And
Lucia, sorry
yeah.
to interrupt. Before we go any further, I realized we didn't introduce ourselves.
Oh,
Do you want to start?
yeah, definitely. I am Lucia Weiss, and I'm one of the implementation support uh, at working in Ventura County through the Central Academy.
You can go next. Hi, my name is Monisha. I am a maternal child adolescent health epidemiologist at Ventura County Public Health, and I am one of the co-chairs of our Shared Metrics Workgroup.
And my name is Sloane Burt. I'm the Quality Improvement Manager with Ventura County Behavioral Health, and I am the other co-chair of our metrics work group that you'll hear us talk more about and the work that we've done. So back to you, Lucia.
Thanks so much for realizing we didn't do that. Okay, and then in 2024, which really goes off this graphic, is when we started the Shared Metrics Work Group, and really kicked this off. There was a system partner from probation that was willing to lead it, and we kind of started the journey there. So we'll go ahead and shift to the next slide. And this really talks about our governance structure that's been a huge support to even make this dashboard possible. You see our ILT, our interagency leadership team at the top. We also have higher level leaders, the wellness system interagency oversight team that even support our ILT. And then below that, you see our wellness system planning committee, which is really a system partner team that operationalize a lot what we're trying to accomplish and really guide and lead our shared metrics work group. And then to the right, the wellness system collaborative, which is much bigger, much larger because it involves community partners plus system level partners, and we get a lot of feedback and make sure we're all in alignment. And you see the shared metrics work group down at the bottom underneath the planning committee. And pretty much everything that we do goes through the planning committee, the collaborative, the ILT, to approve, give us feedback, refine. And so it's this really collaborative process. The work group itself has representation from system partners, community partners to make sure there's a voice in whatever we develop. And then when we develop something, it's brought out to the larger work groups to get feedback and continue to refine it. So there's lots of input along the way in whatever we're doing and creating. Does anybody have any questions about our timeline or our governance structure? Great. I'm sure some of your system of care ILT governance structures are similar, but we've really seen it work so well to be able to get feedback and make sure everything that's being developed is developed collaboratively and not being finalized without a lot of input and feedback. So early on, the work group developed a purpose to collaboratively to kind of focus us and make sure we were all clear on what the work group was trying to accomplish. So we aim to establish shared integrated metrics that comprehensive measures child, youth, family, and community well-being. This involves the Shared Metrics Workgroup defining success criteria, and of course, vetting through the Wellness System Planning Committee, collaborative and ILT to confirm consensus, and leveraging existing evaluation efforts to unify administrative data collection, monitoring, and analysis to make informed decisions that prioritize efficiency, effectiveness, and quality in building our wellness system. Okay, so this is the progress that we've had. We established ourselves as a work group. We developed the purpose statement. We invited membership to serve on the team. A lot of folks are people who do a lot of data analysis at their agencies. So it was people coming together that from separate agencies that really hadn't been in meetings together before because it was such a cross-county effort. So that was really great. We developed a charter, and then we built an understanding to make sure that everyone understood the 2083 MOU, the Comprehensive Prevention Plan, the overall vision of the systems of care work in Ventura County, some of the breaking barriers, values, and the charter for the overall wellness system as well. So we oriented everybody to the work group. Do you want to jump in, Sloane?
Yeah. So I'm going to tell you a little bit more about what it looked like as we got started. So Monisha, if you want to go to the next slide. We had been meeting virtually, but once we had kind of gotten to the point where we were ready to start doing some work, we had kind of a subgroup of people, more of us data nerds, that decided to kind of meet in person to kind of have a lengthier working session to kind of really think through what this dashboard could be, what data it should include, what it could look like. And so we kind of started from scratch and really just started kind of brainstorming data that could speak to the work that we're doing, the goals of the wellness system, and had a lot of ideas. You know, VCBH has this data and public health has this data, and we could get this data from probation and kind of thinking about things, but also we're encountering a lot of, well, that could be challenging. We don't have data sharing agreements, or how could we get that data? How could we use that data? Also, you know, we're talking through, well, what do, you know, how does such data help to illustrate the goals of the wellness system, and how would that show progress, and can that data be stratified in this way? So we kind of, you know, we were as we were developing the vision of what we wanted, we were also encountering kind of challenges in even how to get there. And it felt for quite a while, it felt very like unattainable. Like, how are we ever going to do this? Even had questions about like, what vendor are we going to use? Where's the money going to come from? How could we do that? But, you know, still just kind of kept working through it. And again, honing in on what we wanted this to do. And we wanted a dashboard that could really show progress over time, to see the impact of the services, also to identify where additional like gaps in services created, and such. So I think I was maybe talking a few slides ahead, but so this gives kind of the framework of what we were working with. And also, trying to keep things in the vision of the model, right? So we want to increase alignment, we want to increase access, we want to strengthen protective factors, and ultimately we want to decrease formal system involvement. So as we were throwing around ideas, we were trying to kind of think through this model and also think through social determinants of health. What data do we have that could show financial stability, safe neighborhoods, mental health, housing? So that's kind of where we were going with this. And this happened over many, many months. So, we would meet monthly virtually. We had some additional meetings. I think you can go to the next slide, Monisha. And as I mentioned, we had these in-person meetings. We were throwing out ideas. But encountering kind of more barriers than solutions, as we started working through that. And then there was kind of this aha moment. And so we kind of shifted our approach. And what came to light and what we'll share and you'll hear more about and see is that public health uses a platform that already has publicly available data, quite an extensive amount of data that they can share. And it became clear that we could leverage this existing resource. And so what we did is that we decided of the data that's available on this platform, so Health Matters Ventura County, what data could we pull out and kind of portion out that would speak to the social determinants of health that kind of are framing the work that we're doing. So once we shifted that, it really kind of helped us move forward much more quickly. And we were able to kind of think through what this would look like more clearly. So we started kind of organizing things. If you want to go to the next slide. Again, in the categories that we had, but we went through kind of systematically, and Monisha was kind of a huge contributor and factor and driver behind all of this because of her work with public health and on the dashboard. And we literally kind of went through and we said, okay, what data is already available on the platform? Where could that map to some of our goals and what we wanted to share? We also did throw out ideas of what other data could be available. And is that data something that could be integrated into the current platform? Like, how could that work? There was some, few different mechanisms for bringing in data sources that weren't there, but we were kind of taking the initial approach of let's create like a separate view within the dashboard or within the platform that would be our wellness system dashboard. So it was an iterative process over probably 4 to 6 months that we were just kind of going through and seeing what we had. We would throw in a lot of things. We would discuss it and say, well, you know what, that doesn't really speak to the overall goals. How does this data really map onto this? And would we expect to see any change over time? And so that was just kind of the process. And then as we got to the place where we had some more clarity, you can see in the category or in the column work group recommended measures that eventually we would decide, yes, let's add that, or no, that may not be reflective of goals, or hey, this is a great idea, but let's put that in the parking lot for a future date because that's going to require a little bit more work. And we wanted to at least get going with something. So with the next slide, the way that we did this is that within the work group, we had kind of these monthly discussions, looking at the data, thinking through where it fit. Once we felt comfortable with it, we said, okay, this is where we want to start with our phase 1 build. And, all the while the planning committee was kind of kept generally aware of the progress and the direction we were going in. And then Monisha worked with the vendor to kind of create the sub dashboard, and she'll talk more about that. And then eventually we were able to take that to the ILT and say, okay, here's our initial work, and here's how we would imagine it being used, and kind of get some feedback from the larger ILT to determine that. And so that's where we started. And this all just kind of finally came together late in 2025. And that's where we're going to kind of dig in and show you what we're talking about here. So I'm going to hand it over to Monisha.
Thank you, Sloane. So I will be doing a dashboard demo of the dashboard that we have been referencing. But first, just going back to what Sloane and Lucia mentioned, we initially started on a Word document with ideas kind of being added to tables. And we held the in-person work group meetings that Sloane mentioned, focused on metrics selection. We transitioned to Excel. It was a bit easier to kind of organize our thoughts, put in different links, things like that. So we finalized the metrics, and so can you see the spreadsheet? Perfect. So this is the actual spreadsheet that we utilized after using the Word document. I'll zoom in a bit just to give you all an idea. So here on the left, we have the various social determinants of health. And then in the second column, we kind of mapped out which measures we need to address with the data. So for housing stability, for example, we want to know, first of all, who is our population of focus? So we want to know what was the number that resulted from our homeless population count, which we do every year as a county. We want to know how much families are spending on their mortgage payments, on their rent payments. And those are all indicators that are already available through various publicly available data sources. So census, as an example, ACS, they do have a lot of those metrics available. So then kind of leads into, our data sources. So VCOE is our County Office of Education. So you'll see that acronym a few places. Gold Coast is one of our Medi-Cal managed care plans. ACS, as I mentioned, we used EDD department data to show unemployment rates. What else? The California Healthy Kids Survey we also utilized as well. And then our Interface 211, which is a resource hub here in Ventura County. So these are the data sources we pulled from, and there are plenty of data sources for community safety, also California Department of Justice. Those are some of the data sources that we used. And then for easy access, as we were going through this process, we just put in the link in there. That way, as we're discussing during meetings, we can kind of quickly reference these things. And with data, it's important to have the most recent up-to-date data. And so with publicly available data, sometimes there is a lag of a couple of years. So we wanted to ensure that we noted what was the latest year of data, because it does matter if we're in 2025, we can't be looking at 2019 data because so much has changed since then. And then, as Sloane mentioned, we did go through a voting process. And so here we have some yeses, we do have some no's. So, these types of discussions required a lot of conversation, kind of going back and forth, the pros and cons. And then we kind of have it organized here, and all of our work group members had access to this spreadsheet. That way we can kind of go back and maybe think, maybe we should add this on, maybe we shouldn't. And then we also have a notes section. So we call this our brainstorming document. This is kind of where we mapped out what we wanted to have on our dashboard, and then that led us to our dashboard. So I'll show you here. So this is our dashboard. This is our landing page. And in the beginning, it kind of talks about our children, youth, and family wellness system, kind of who we are and our purpose. And then from here, we have some instructions. So how to use this dashboard, just in case maybe someone stumbles upon this dashboard and they're not familiar with the wellness system. And then as you go down, it does show the social determinants of health. So we made it orange just so it stands out. And then also there is an option to expand these especially for those that are not familiar with the various social determinants of health. it kind of gives an explanation on what it is and maybe like why it's important. So, for example, for community safety, I know when I was learning about this in school, we call this neighborhood and built environment. So that's what we put here. And then it says these are factors related to your zip code or the specific community you live in, which includes a report for your health and safety. So that just kind of gives folks an idea of what they're looking at, what this page is. And then you can also collapse this to make it a little bit cleaner. And then as you go down, so it says Ventura here, and then it has all of the social determinants of health that are mentioned here in orange. But first, I would want it to show, so Ventura is our county. However, if different data sets are available for specific cities, you can scroll down. And for example, for Camarillo, which is a city within our county, it will show data just for Camarillo. So it's sort of a filtering option. So I'll go back to Ventura County for now. So in addition to city, scroll down all of our cities, we also have zip code. So a lot of different programs and organizations maybe refer to zip codes when doing work. So we do have the option to look at zip code, and then when you click on it, it will show metrics specific to that zip code only. And lastly, we do have census tract as well. Some organizations may use census tracts when looking at data. So that option is here as well. And if there is data available for that census tract, it will show up. So going into the metrics, we have first housing stability. These are all of the metrics that we picked to include for our housing stability, social determinant of health. And on the left-hand side here, we have a legend that kind of explains what all of these colors mean. So red is bad, green is good, and then blue is not statistically different or neutral. And then it kind of shows what the gauges mean. So if it's going towards the red, it's bad. If it's going towards the green, it's good. We have some healthy people 2030 targets. And so if it does meet it, it has a little green check mark. If it does not meet the target, it has the red X. And then it also shows kind of comparison values. It has arrows showing trends, and then the same colors as well. So green is always good, and then red is worse. So you can hide the legend here. And so as an example, so this first indicator here, renters spending 30% or more of their household income on rent. This is our county value. So this means that 56.9% of renters spend 30% or more of their income on rent. And so these gauges here show that compared to the other 57 California counties, that we're doing okay compared to other counties since it's leaning towards the green. However, when looking at the rest of the US, so the other US counties, it's going more towards the red. And so this also shows the California average, which is 55.8, and then the US value, which is 51.8. And then it does not meet the Healthy People 2030 target, which is 25%. So Healthy People 2030 wants only 25% or less to spend 30% or more on their rent. So that just kind of shows what each of the indicators mean. So these are the indicators, and then some indicators also have race, ethnicity, and also gender data available as well. And if it is there, it does show it here. So we have, for example, our homeless count data. We had 22 for the year 2024. We had 22 females, 48 males, and then 1 transgender. And then we also have it by race, ethnicity. I'll go into some other data points. So for financial stability, just as an example, we have children living below poverty level. This is a metric that a lot of our organizations look at. And so we see compared to California counties, we're almost in the yellow. Compared to other US counties, we're towards the green, but still kind of in that middle area. The good part is for the VC 2020 target, we did meet that. So for our 2020 goal, we did meet that. And then it does show the prior value. So it does show that we had 13.3% previously living below poverty level. So it did go down a little bit with the 12.6. And it does have the other demographic information as well. So female, male, and then the overall, and then also by race and ethnicity as well. So as I scroll down, we do see other indicators, and then it goes into the education, social determinant of health, and the same with the other demographic information. So I won't go through all of them, but just to give you all an idea, scroll down. And then I wanted to show our lag measures. So these are our lag measures. So over time, as the wellness system, we do our work, we implement a lot of the learning lessons and various activities and programs. We want to ensure that we have some lag measures that we look at that over time these improve or go down depending on the measure. So we picked two. The first one is the juvenile arrest rate. So as time goes on, we'd like for this to, go down. So currently we have 8.3 arrests per 1,000 population for 17 and under range. And this is through publicly available probation data. Then we also have our foster care and care rate. So we have 1.7 cases per 1,000 children. It is lower than the California value, which is 4, and it did decrease from 2023, where the rate was 1.8. So that does show some improvement, and so that's why this green arrow, it's going down, but it's good that this goes down, so that's why it's green as well. And then when you click on one of the indicators, so for example, children living below poverty level, it's not limited to just this page. So if you were to click on it, indicator, so this is the link here, I'll be showing children below poverty level as an example. When you get to this page, it shows the overall percentage, so 12.6% of children living below poverty level. And then it also has some kind of highlights and key points that, maybe if you're a student working on a report or if you're filling out maybe a grant application or anything like that, it kind of tells you some key summarized points. So worsening over time, and then it says we're in the best 50% of California counties, in the best 50% of US counties, and then lower and better than the California value. And so from here, as I mentioned from the other page, you can also look at cities, zip codes, and census tracts for this specific indicator as well. You can also go back in time and look at older data. So we have data going back to 2018. And then depending on which measure is applicable to this, if there was a Healthy People 2030 target, this would show here. The data I will be showing you is looking at rates, but you can also look at counts as well. And then this also tells us, what are we looking at? So what does it measure? So this indicator shows the percentage of people under 18 who are living below the federal poverty level. And then it kind of shows a little bit of the methodology. So what's the numerator and then what's the denominator? And then it also explains, why this is important. Why are we looking at this indicator? Why do we collect this data? So it talks about, children's well-being, the impact of living in poverty over the lifespan. So we have that here. And then here we have our data chart. So it shows here in this line graph, as I mentioned, the data is from 2018. That's the oldest that we have. So it shows over time the rates, and then it has our current rate, which is 12.6. Previously, it was 13.3, so it did go down, which is good. And then if you scroll down, we do see a graph with various demographics for this specific indicator. So this shows the subgroups by age, gender, race, ethnicity. And then we have further resources, anything related to this. We have other, since this is children living below poverty level, we have other indicators that you can quickly click on and it will come to a similar page. And all of the pages look similar, and that's intentional just so it's easier to access. And then down here, we have the sources. So it tells you where this is coming from. So as I mentioned, we have a lot of students that utilize Health Matters. So it's really easy for them to see where the source is. And when they click on this, it'll take them right to the ACS site. And then it also has a specific table that's that this data is housed in at the census website. And then it has when it was last updated. So that's that. And then I did want to show a specific feature that we have on this site. So this page right now is currently looking at all of Ventura County. But if I go to Oxnard, which is one of our larger cities here, it'll update the information to just show Oxnard. So you see the percentage is a little bit higher. So it's almost 17% in Oxnard. And this uses ECS has different data sets. Sometimes they use a 1 year summary, sometimes they use 5. So that for this specific one, they use the 5 year summary, which is why the period is different. And so here we see the summary points are different. Oxnard, we do see quite a bit of disparities in that community. So we see that's kind of reflected here where it says that it's higher and worse than the county average, higher and worse than the California average. And it is improving over time, which is great. But it is higher than the US average, the county average, and the state average, which is something that maybe CBOs may, want to know for any resources or any interventions or activities they may want to do. So here we see for Oxnard specifically kind of how this fluctuated. So this one we have some more historical data going back to 2011. So we see over time it has improved, it kind of stabilized, but it has improved. So obviously we'd want it to get a little bit lower. Here we have our time lapse feature. So what you can look at is, what does this look like over time? And here it also shows our Oxnard rate compared to other census place or cities here. So we see that Oxnard is kind of among one of the higher areas. So the time lapse feature here, you can compare it to other Ventura County cities, or you can compare it to other California cities. So let me just, so if I play this, you can see, hopefully, you can see how so this is Oxnard here, it kind of changes. So compared to other California counties, it always remained worse than the California average, which is not great. So that's something, we need to work on for that community. And then I did want to show another example. So children with health insurance. So same thing, the page looks similar. It shows, what this measures, the changes over time. It also has the time lapse feature. And then it has some data tables as well with the bar charts and the sources as well. I did want to show also how this time lapse works as well for children with health insurance. So,
Monisha, we do have a few questions, so maybe after you show this one example, I can read off some of the questions.
Sounds good. So comparing to California counties, so let's see here. This is children with health insurance. So overall, we're doing pretty good with this measure for Oxnard, 97.5%. And so in this case, the time lapse green is good, of course, and it also shows you what the colors. So not only is it green good, but in terms of numbers, so greater than 97 is green and the best 50%. And so the time lapse, see here. And the timeline will always show when it's going back to. So in this case, it's going back to 2017. And the key area we're looking at here is Oxnard. So we'll see kind of maybe if anything changes. So we do see some changes. You can also pause it too. So I'm pausing here at a time where the rate kind of fluctuated below this state average. So compared to the other 57 counties. So we see here it was red. 94.5%. second, sorry. So it was less than 96.2 at a rate of 94%, which is why it's red. You can see how the colors kind of visually change over time, and then you can pause it to take a deeper look. But I mean, it's good to see that when we get to 2024, that the rate is higher than the other California counties, which is great. So that
So I wanted to make a point about, public health is not a required partner for interagency collaboration, but if you caught Monisha's introduction, she's from public health. She's an epidemiologist. So this is her work is being data informed and to help inform policy decisions for the county. So if you don't already have public health as a partner, from the wealth of information that Monisha's sharing and providing and the access to community level data that we've been able to obtain, it's really been such a great partnership with public health and Monisha to be able to accomplish all of this and all these cool features that we are able to accomplish in the dashboard. And we like Sloane said, we do have a couple of questions in the chat, and maybe we can answer those. And then also, I put a comment in the chat about the Health Matters because this was our wellness system, systems of care dashboard was a sub dashboard to a larger community county health dashboard that we leveraged to be able to build this dashboard and have all these incredible features that Monisha is going over.
Yeah. So Monisha, maybe you could speak to the vendor and who you work with for both for this whole endeavor. And then there was also a question about the updates to the data. So maybe as you're talking about the vendor, you could also talk about the kind of where the data sources are coming from, which relates to the updates.
So the vendor is Conduit. I don't know if it's yes. So Conduit is our vendor. And if you're interested, I can put the email of the specific person we work with in the chat. So public health, we already had an existing contract with the vendor. So if I scroll up our main page here, it has all kinds of community information. It has our CHNA, our community health needs assessment. So we were already using Health Matters as kind of a data hub for the community. If they had any questions about data, we have data about various infectious disease conditions, essentially all the social determinants of health. But if you see here on this menu, we kind of lifted up the wellness system dashboard up here, but you can look at all types of data. They have their own specific indexes that they have. So this isn't related to what we do in the wellness system, but just an example. This is some other data that we have that looks at like food insecurity with same thing with the color ranges. So, higher need is darker green. So we do have other types of data available as well, but the wellness system dashboard lives on this site. So we made it as easy as possible to find, being it the first option. So Conduit, and then in terms of data update, it's part of our contract that the webmasters, so the people that we work with on the contract, they have folks that automatically update data for any existing sources that we have. So any ACS data updates, any CDC data updates, CDPH, of course, as soon as those data sets are available, they are able to upload that to our site. And then from there, we can use that data for any other metrics. We also do have hospitalization and ER data on Health Matters. And for that, we do have to request it as a county from HCI. And then once we are able to get that data, we do have a data sharing agreement with Conduit. And from there, we both analyze that data and we put that data on there as well. So it's a mix of both. We, the county public health department, we request the hospitalization ER data from HCI. And then for the other publicly available data sets, that is uploaded automatically by Conduit. And then from there, we have whichever metrics we would like to use the data for. Let me see other questions.
I did just want to jump in that one of the reasons why we wanted to share this is, one, we're really proud of it. But two, even if you don't have the capacity to build a dashboard or a platform like this, really want to elevate that a lot of these are publicly available data sets that can be, sorted by county and such. And so our hope is that, you could also play around with our dashboard, find some of the data sources, and then, think about ways that you can leverage those in your own county. Again, even if it's not in a wonderfully fancy platform like this.
Yeah.
But also that there is the capacity to kind of pull in unique data sets. So that's one of the things that we're hoping to do in the future, kind of teasing out some of the data from Ventura County Office of Education, bringing in some data. We've already had some initial conversations. We have a family justice center, so we wanted to look at the rates at which people are leveraging that resource. And then kind of thinking through some other data. So there is a mechanism by which you can kind of, import and then process the data so it could be viewed in a similar way. We will talk a little bit more about this at the end, but I just want to address Abigail's question, which was about are your county leaders actively using this to drive policy and budget decisions? So that's the ultimate goal. As I mentioned, we just kind of finalized this in December and we've been starting to share it. So we have some kind of wheels in motion, but ultimately, it's kind of a lot to navigate, but once you get familiar, I feel like it's fairly easy. It takes a little bit of time to kind of click and find the right things. But our hope is that more people will know about and go to the dashboard because it's kind of a curated set of data that speaks to the wellness system. So, Monisha, I don't know if you want to add more about that or some other examples of different data.
Yeah, and just as an example, just in case, if you want to maybe have something similar for your county or for your organization, I clicked on one that didn't have an ACS data source just because ACS is available for almost every area. But for this one, youth under probation, so scroll down, and as I mentioned, the sources are on the bottom. So you just click here. And then we went to California County Probation Dashboard. And so from there, so for each of the metrics we have on our dashboard, you can scroll down to the source to see if data is available for your county. So just to show you how to use this dashboard, we don't own this. It's owned by the state, the California Probation Office, but you can scroll down to your county and look at your rates for your county. So for example, if you're in Orange County, you would see the rates posted here. And then you can also, if you right click on Power BI, they use Power BI for their dashboard, you can show it as a table. So you can kind of easily see the raw numbers there. So that was another example of being able to kind of look at the source to maybe, if you want to, replicate it, here, so this dashboard. So there's that, and then going back to our PowerPoint, we did put the link to the dashboard in the chat. This isn't going to be a breakout activity. I don't think we have the capabilities to do that, but we want everyone to go onto the dashboard and kind of look around and look at different metrics, maybe look at something that is of interest to you, something you maybe want to learn more about, or just maybe just pick a random one, but find a disparity. So maybe looking at, I'll just show you as an example. So as an example, so for this one, looking at Ventura County, and you can play with the locations, but maybe seeing, what areas are in need of, or what areas are experiencing disparity. So if you go down here, you can see there's more males in terms of children living below poverty level. With the race, this one, it has other being more, but if we kind of look at the ones that are named, we have Hispanic, Latino compared to Asian race, white, non-Hispanic. So that would be an example of a disparity. So maybe, if you are interested, going and looking at and finding a disparity, and then we can share after.
So so if you're able to either to split your screen or you can kind of minimize the Zoom, we'll give you about 10 minutes to play around, and then bring everybody back if you have questions, comments, thoughts, before kind of we conclude.
Are there any
Sure,
questions,
yeah.
any additional questions we could address before you all go and do the activity? Any comments? I did also want to share that there's also a family level data work group that is looking at indicators for what they're calling the family connection locations. And so once it's kind of like building out the family resource center locations and then having universal intakes, and being able to use that data for the dashboard too about how often those are being utilized, what kind of data is going to be utilized for, or what kind of services are being provided, how the protective factors are increasing, so family functioning is increasing, measuring that. And so there's definitely going to be an evolution and building out of this dashboard. Also with the comprehensive prevention plan, it's really focusing and narrowing down on particular zip codes. And so we'll create a sub dashboard for that work to be able to monitor those outcomes. And it's really our goal this year to build policies and procedures and propose some ideas for what those could look like. And it'll go through that feedback loop of all the governance structure that we talked about, just like we got approvals and feedback for the dashboard. Did anybody want to jump in and share about their dashboard work, the successes you've had and challenges you've had? And any other questions we could address? Okay, there's another question in the chat about data on individuals with disabilities and then regional center data. It's a really great question.
Thank you for asking that. So in terms of the wellness system dashboard, I don't believe we have related to individuals with disabilities. Let me just double check. Here. On this dashboard, we don't. However, on our overall site, so again, not technically related to wellness system, if you so we have a search this site here, and if you typed in disabilities, we do have indicators on our site in general for any individuals with disabilities. Where did the question go? So, for example, and that's, maybe that's something we could potentially add on to our wellness system dashboard as well. So just an example, and that way we can kind of look at the data source as well. Right, I realized I wasn't sharing that screen. So let me just go back since I wasn't sharing that part. So in our just overall site, if you go to search this site up here and I typed in disabilities, it has this list of indicators that show, any types of populations with a disability. So
Does it show kids?
yes. I have too many tabs open. So let's look at children with a disability. So if you click on that, it's first going to ask you, do you want to look at this by county, by census place, so cities, zip codes, or census tracts? So if we just look at county as an example, we have this, so 3.7% lower than the US value. This is just overall children with disabilities. But I'm sure there are other indicators that show, let's see here, the other. maybe like adults with disability living in poverty would be another one to maybe possibly look at that gives us more data related to that population. So this, I mean, fairly recent in terms of publicly available data. So this shows the percentage of adults aged 20 to 64 with any disability who are living below the poverty level. Shows why it's important, and then it shows the data over time. Scroll down, and the source is 5-year. Also, our regional center, they are part of our wellness system as well. So they do attend our overall meetings for, I believe it's the planning or the collaborative they're a part of. So they are worked into our county wellness system as well. So we do have that data in health matters in general, but not on the wellness system dashboard. But that's a good point. We could probably maybe take it back to the group to see, you know, that possibly would be a good one to add on. So serve as the official website. So Allison, yeah, so Allison shared that they're just in the beginning phases of building a CWS focus one where ILT and IEC build their for a data dashboard.
So Allison, can you share a little bit about what that process has been like so far and what's been some of the struggles, but some of the things where you're still seeing hope?
Can you hear me?
Yeah.
Yes.
Um,
Good to that you're
hi.
joining our our breakout today.
Of course, I love data. I will say our missing part is our data analyst who is on maternity leave. So it's been a slow process. And then for child welfare, we're changing systems. And so kind of making that, do we do all this work with CWS, CMS, and business objects, or wait until CARES comes out and use Tableau? So we've kind of gone back and forth on like how much work do we actually put in before having to change everything over. I think we have ideas of, we have a solidified list of all the data points, but it would be the building of it. And then we've kind of paused while ILT, IEAC kind of figure out what platform they want to use, what that looks like. So child welfare looks good. Like we've got our data points, but it's getting everybody to the same place we are.
Well, and so are a lot of the data points child welfare data points? Because you could see on this dashboard, it's really community focused.
So because they are building like the wellness one and our stuff will feed into that, but we're just in charge of building the CWS one.
Yeah.
And so all of ours are CWS related.
Yeah.
But there is the bigger group that's looking at like the county wellness. And not am I not part of that committee? I feel like I'm part of that committee.
I hope you are.
I don't know. I feel like I am, but they still have to figure out platform and data matching and all of those things. So we're very premature in our adventures in this.
Okay, well, let us know if you need any support.
Oh, I took lots of notes. I'll be sharing.
Good, good. And then Janelle found a disparity that she put into the chat. What did you find, Janelle?
I just mentioned how interesting it was to me to see just on one aspect of who has a bachelor's degree, and it's almost all of Thousand Oaks.
Wow.
Only pure green compared to Oxnard that doesn't, it may have like a little sliver of green, I'm not even sure, but it just makes me wonder why. I see all the other things, but why?
Yeah.
Disparity. Yes, thank you, Janelle. Anyone else have any other disparities they'd like to share with the group? If not, as I mentioned, you can also utilize the data sources to look at your own county's data, and then from there, you know, looking at those disparities as well. Okay, I'll go to the next slide.
Yeah, sometimes we know or we believe that there's disparities, but having the data to back it up is so helpful.
So for sure, keep the questions and comments coming, and feel free to continue to explore as well. We kind of just uh, continue the conversation. We did want to share a little bit more and mention this is that, we just kind of launched it with with our ILT. We throughout the Ventura County Wellness System, we have a newsletter. So our one of our next steps is to put in a blurb with a link to the site in the newsletter to kind of communicate that more broadly. Ask people to kind of share through their different, their different connections, their different scopes of work. And then we want to develop some policies and procedures. Now is kind of an interesting time with some of the transitions that are happening with the wellness system. But we want to kind of try to maintain some kind of integrity of the dashboard, also ensure that it gets updated, that we kind of provide some guidance around how the information could be used say on an annual basis to kind of evaluate what changes, if anything. Now there are understandable like limitations. Some of the data is lagged due to the design, but it doesn't mean that you can't kind of use it for information. And as you've seen, as you break it down, there's some interesting information that you can glean from looking at kind of subpopulations or differences across the county. So we are still kind of working through what this would look like, wanting to continue with the shared metrics committee as a work group to continue to drive this. And also we want to consider and take actions to bring in additional data sources. So I mentioned one or a few earlier. There's some other ones that may be publicly available, but they're not part of the kind of the dashboard already, the Ventura County Health Matters dashboard. But it's a lot of information, and I think it does take a little bit of time to learn how to navigate it. Another idea that we thought of is doing like a 2-minute kind of video to share for maybe some constituents across the county that may be interested in navigating or learning from the dashboard, doing kind of doing like a little introduction, like here's how you can find this. This is what you can tell you. Monisha is obviously an expert and can kind of just whip through all of it, but not everyone can do this. But wanting to make it as user friendly, because it is a complex dashboard, but wanting to make it as accessible and user friendly as possible. So that's kind of where we are. I don't know if Lucia or Monisha, you want to add anything more to that. And again, keep questions, comments coming, and we want to also hear your thoughts and ideas.
Yeah, one of the things that strategies helped us develop was people might be part of the Cal Prevents site and be members there, but we created a Ventura County specific Cal Prevent site, and it's called Partner Connections, VC Partner Connections, and that's another communication tool we utilize to post how-to videos, updates, information, links, so that we can share what the work group is all the work groups are producing, and maybe you weren't at the meeting or you didn't catch the link, and so it's another way that we're going to be posting and sharing information. Yeah, Janelle.
I'm just wondering if Ventura County sees some sort of collaboration with BCCIE with all of this information.
Who wants to take that one? The information
I
exchange.
know it could be a big tricky question.
This point, I mean, we haven't had those conversations yet, but maybe we will, in the future. No, they do have, they have several CBOs onboarded, but at this point, we're not getting any data from CIE for the wellness system dashboard, but that's definitely a conversation I think we can have with them. I think that's a great idea as well.
Mm-hmm.
I just wanted to highlight how much I appreciated how you have those little links to go and look at the citation. extremely
Yeah.
helpful, because what I always want to know is our research. How well is this research, right? Should
Exactly.
we be using this research, or we want to do our own research on your research? And so thank you for being a part of this, all of you guys.
Good question. We did have another disparity identified. Bud, go back to the chat. Bud found disparity dashboard an example in 2024 that 6 through 15-year-olds were more likely to enter foster care. Yeah, so really it piques your curiosity. Why is that?
And then also thinking about just the impact in terms of their mental health, at that age as a teenager, kind of going through that process. So I did put our conduit in contact. I already spoke to her, and you can email her if you'd like, if you are interested in learning more. She's our account manager with Conduit. Any questions?
And thanks, Luis, for the shout outs on CalPrevents. Luis has really helped us a great deal in Ventura getting our CalPrevents Ventura site off the ground. And we try to team together and be active users. So people are using it, and it's pretty much on every PowerPoint to join it and get alerts. And we have guiding documents on there and lots of information on there. And the how-to videos. So yes, when we make our how-to video, Luis has a lot of experience in doing that. All right, any other questions?
We can give people some time back.
We hope this was helpful, and I hope it inspires you and gives you some ideas of how to get started or keep going on your dashboard.
And I'll put my email in the chat as well. I'm happy to answer any questions that you think of later.
Great.